So I know we've been discussing over the past couple of weeks that getting the booster vaccine is important, but in the past week, a number of additional studies have been produced that really put a spotlight on how effective they are. So we're going to spend some time today talking about some of these new booster studies and again, as you said, Governor, why it's so important. Let me start first, though, with sharing some survey data from the Kaiser Family Foundation from a survey done in December. Now, not surprisingly, in the face of spreading the Omicron variant, 50% of the public said they were worried they would get seriously sick from COVID-19, and that was up from 30% in November. Interestingly, this concern was greater among minority populations. So 64% of Hispanics and 64% of Black individuals said they were concerned, compared to 43% of white adults. So as the governor just said, we know that getting vaccinated and boosted is a key way to reduce the chance for getting sick. But our booster rates are not where we need them to be. Delaware ranks 26th among all states in overall booster uptake. We know that we can do better. So we're trying to understand the reasons why booster rates are low here and nationally. So on this next slide, I wanted to highlight some additional insights that came from the Kaiser Family Foundation survey, where they identified confusion around booster recommendations among Americans in December. So 23% of adults, including 21% of vaccinated persons, reported being unsure as to whether or not it was recommended that all adults get a booster, or they incorrectly said CDC's not recommending a booster for their age group. And again, we saw disparities. They saw disparities in these data. So this confusion or uncertainty was greater among racial and ethnic groups, as well as younger adults. So 31% of Hispanic, 28% of Black, and 39% of younger adults between the ages of 18 to 29 reported being unaware of CDC's booster recommendations.